Sherry Carlson along with her. And I will let her introduce her when the time comes. There are a few housekeeping rules I'd like to go over. And first one is if everybody could stay muted during the webinar, that would be great. So we don't have any feedback or additional noise during the webinar. If you have any questions, please type them in the chat box and Lisa will be answering as many as she can at the end of the webinar, depending on time. And I'm sure if you have additional questions, she'd be happy to answer them through email after the fact, but we should have time for questions at the end. There is 1 CEU credit for attendance being offered to licensed social workers, licensed independent social workers, and social work assistants. So upon the ending of the seminar, you'll have a survey and we will be able to get that certificate to you. And we are recording this webinar and we will be posting it on our website, sil-oh.org. And it will also be on our YouTube channel, which is Services for Independent Living. And that'll take about 5 days to get posted. So you'll be able to go through the webinar again. Also, all our past webinars are on there as well. So there might be something else that piques your interest. Without further ado then, I will turn it over to Lisa and she can get started. Lisa, are you still muted by any chance?
Yeah.
Okay, I was gonna say, I couldn't hear you speaking there.
I'm sorry, it took me a minute to unmute myself.
Yes, I'm sorry. It took me a minute to unmute myself.
The first of all, let me introduce myself.
First of all, let me introduce myself.
I'm Lisa Marn.
As Jackie said, I'm Lisa Marn.
I'm in the
I'm the PCA LTSS coordinator here at SIL.
I've been here for almost 24 years.
I have been here for almost 24 years. Long time.
And the voice you hear is Sherry Carlson.
That voice you hear in the background is Sherry Carlson. Sherry is my personal care assistant.
Or
PCA, and she will be repeating my speech today.
And this
This funny looking thing in my head is my head stick. This is how I type. Without further ado, let's get into why we're here. I would like to talk about home health care and PCA services.
There are a number of terms used in community to report to someone who assists a person with a disability with activities of daily living.
There are a number of terms used in the disability community to refer to someone who assists a person with a disability with activities of daily living.
Some of these terms are
Some of these terms are
home health aid,
home health aid,
personal assistant,
personal care assistant,
PCA,
or PCA,
direct care professional,
direct care professional,
direct care worker,
direct care worker,
and then probably others I missed.
there's probably others that I've missed.
But for the purpose of this webinar, I'm going to be using the term PCA.
For the purpose of this webinar, I am going to be using the term PCA.
The essential worker became a bright space in 2020 due to the pandemic.
Essential worker became a buzz phrase in 2020 due to the pandemic.
The worker outcomes essential.
Healthcare workers are considered essential.
However, I never mention of PCAs per se.
However, I did not hear any mention of PCAs per se.
Besides PCA services are crucial to daily living.
For some of us, PCA services are crucial to daily living.
The PCA does not have the value of prestige.
The position of PCA does not have the value or prestige it should have.
This is usually have low pay and little or no benefits.
PCA usually has low pay and little to no benefit.
This needs to change to elevate the role of PCA.
This needs to change to elevate the role of PCA.
This is a subject for future webinars.
This is a subject for future webinars,
So stay tuned.
so stay tuned.
But there is a poll for you.
Now we have a poll for you.
We have a quick poll for everybody. And it is in regards to the importance of PCAs. And in your opinion, has the importance of PCA services changed during COVID-19? If you could take a few minutes and select your answer, that'd be great. A few more seconds here. All right, I am going to stop the polling. And it looks like we have a resounding 100% yes. And Lisa, I'll let you continue.
Thank you, Jackie.
So, everyone who took a poll
Everyone who took our poll
agreed that these services were important
have said that PCA services were important
during the pandemic.
during the pandemic.
It's always been important.
It has always been important.
Yeah. Predominant myself. Excellent.
For some of us, like myself, I cannot get out of bed without assistance.
That was that come to work. My life come to explain or
When a PCA does not come to work, my life comes to a screeching halt.
what others did it was me as reminders which is let's stand activity they George in the situation.
For others, PCAs help with medication reminders, which is a life-saving activity, daily chores, and decision-making.
During the COVID-19 pandemic, some people were only interacting consumers with the outside world.
During the COVID-19 pandemic, some PCAs were the only interaction some consumers had with the outside world.
It literally loneliness and isolation.
They alleviated some loneliness and social isolation.
That makes you put in this.
So what value can you put on this?
In my opinion, it's priceless.
In my opinion, it's priceless.
The about universal hygiene now.
I want to talk about universal precautions now.
Universal hygiene always been important in any field. However, COVID-19 made universal hygiene extremely important.
Universal precautions have always been important in any healthcare field. However, COVID-19 made universal precautions extremely important.
By now, everyone knows COVID-19 is very contagious.
By now, everyone knows that the COVID-19 is very contagious.
People with limited symptoms are often reach out infected with COVID-19 or COVID-19 could be potentially more dangerous due to underlying health issues.
People who receive PCA services are often at higher risk of contracting COVID-19, or the COVID-19 could potentially be more dangerous due to underlying health issues.
So, what are universal precautions?
So what are universal precautions?
They refer to the practice of avoiding contact with viral fluids.
Universal Precautions refers to the practice of avoiding contact with the bodily fluid.
according to the
That's according to the CDC.
the it they recommend washing hands with warm soapy water for at least 30 seconds or using hand sanitizer.
The CDC recommends hand washing with warm soapy water for at least 20 seconds or use hand sanitizer.
So let's see how long 30 seconds is.
Let's see how long 20 seconds really is.
Oh, it's not.
Hold on, it's not playing.
It's long.
That's rather long.
It's not like it. And
If you think about washing your hands,
it's important. It's important.
but it is important.
Yeah. Then that
You can sing Love Shack,
everybody tries
Happy Birthday Twice,
everything.
ABCs.
A company tries.
There's a couple different songs.
This man.
I tried to make this fun.
Another bowl.
Jackie, we have another poll.
You're muted.
You're muted.
Okay, unmuted now. I was busy singing. I didn't want you guys to hear. Okay, the next poll would be, I think washing my hands for 20 seconds is too short, long enough, or too long. And I will let everybody click in their answers. All right, I'm going to go ahead and stop the polling. And it looks like, again, we have another 100% for 20 seconds being long enough.
Yeah. Even though that's what the recommends.
Thank you, Jackie. Even though that's what the CDC recommends.
I thought
I just wanted to see what you guys thought.
the going.
Let's go on.
I'm not playing that again.
I'm not playing that again.
Coffee and sneezing.
Next is coughing and sneezing etiquette.
You guys up in the
You can always cough You should always cough into a tissue,
and then discard it
then discard it,
and wash your hands immediately,
and then wash your hands immediately.
or cough and sneeze into your elbow,
Or cough or sneeze into your elbow,
like the picture shows.
like a picture shows.
Okay. You disinfect or write down common use out of items with disinfectant cleaning product.
You should disinfect, wipe down commonly used household items with a disinfection cleaning product.
Just as close to handles
Some of those common items are door handles,
that do it
light switches,
remote control.
remote control.
It's not about
That's not talked about a lot.
appliances,
Appliances,
services,
countertops,
this
sinks,
and that treatment
adaptive equipment.
for every type of
Whatever is touched a lot.
we do that now.
When doing direct care, like dressing, bathing, toileting, you should wear disposable gloves.
When the day is complete, remove the gloves and dispose of them.
When the task is complete, remove the gloves and dispose of them.
And always raise the hand at you get gloves.
Always wash your hands when you remove your gloves.
And talk about PPE.
Now let's talk about PPE,
Who personal protective equipment.
or personal protective equipment.
PPE refers to any available equipment that is designed to protect one from exposure to or contact with infected agents.
PPE refers to wearable equipment that is designed to protect one from exposure or contact with infectious agents.
According to the CDC,
This is according to the CDC.
we have had more experience with PPE since COVID-19.
We have had more experience with PPE since COVID-19.
Some examples are
Some examples include
gloves,
gloves,
face
face masks,
easier,
face shields,
protective eyewear,
protective eyewear,
and protective clothing.
and protective clothing.
So let's talk about PPE and clear.
Let's talk about PPE as it relates to direct care.
This recommends wearing face and public.
The CDC recommends wearing face masks in public.
The dilemma comes when silence is working in a private home.
The dilemma comes when someone is working in a private home.
So, the immediate arrangements in a consumer and
Sorry. Should a PCA wear a face mask in the consumer or client's home?
this is recommend when you're not gathering with people outside your home. But I'm sorry, I messed up. But this is recommend when you this is the type of air. This is recommend you not gather with people outside of your home without business.
I'm sorry, there's a typo here. The CDC recommends that you not gather with people outside your household without face masks.
So, there's a business recommend
So yes, PCA should wear a mask in the consumer's home.
why? Well, it's to protect the consumer from what the direct network may be exposed to when the network.
Why? To protect the consumer from what the direct care worker may have been exposed to when not at work.
It also to protect the PCA from anything that consumer may be exposed to around other people.
It also protects the PCA from anything the consumer may have been exposed to around other people.
And maybe everything wrong.
And now we have another poll.
So, well, our next poll in regards to PPE is a question on the availability of PPE and how you feel that that is. Is it limited? Is it good now? Or is it able to be accessed all over? We can find it everywhere. And once again, I will let everybody lock in their answers about the availability of PPE. We'll go for a few more seconds here. Okay, I am going to go ahead and end the responses now. And we actually made a break from our 100%. And this time we've got 64% saying it's good. We've got 21% saying they can find it all over. And we've got 14% saying the supply is still limited.
Thank you, Jackie.
Bobby 9 months ago, it was really hard to find.
About 6 or 9 months ago, it was probably very hard to find. Face mask, hand sanitizer, toilet paper. Not PPE, but that was limited. It's better to find face masks and hand sanitizers now.
could be.
but not as good as it could be.
I don't know it. I
I would like to talk about what I call home protocol.
I remember that it's not in the
A PCA should always remember that he or she is going into a consumer's home.
and that they are performing or be personal.
The tasks that they are asked to be performed are personal.
The considered explain it like to be safe and comfortable in their home.
The consumers have the right to feel safe and comfortable in their own home.
I think receiving a business concern is already invasive to outsiders into their home and performing tasks.
Honestly, as a recipient of PCA services, I can say it is already invasive to have outsiders enter your home and perform intimate tasks.
And it's like the develop information for the visitors in order to be safe.
Consumers have the right to develop and implement protocols for visitors in order to feel safe.
I will share with you what my plans I have put in place.
I will share with you what my fiance Eric and I have put in place.
I visitors our own and visitors are asked to
All visitors to our home, including PCAs, are asked to
with our time visiting.
wear face masks at all times when visiting.
Sanitize and by entering our home.
Sanitize their hands upon entering our home.
The temperature by entering.
Take their temperature upon entering.
Place the cell phone in the ultraviolet sanitizer for a few minutes.
Place their cell phones in an ultraviolet sanitizing box for a few minutes.
This is not something that you probably have heard about.
This is not something you probably have heard about.
But cell phones are extremely dirty.
Cell phones are extremely germy.
People don't realize that their cell phones are exposed to everything they touch.
People don't realize that their cell phones are exposed to everything they touch.
The brought I cell phone sanitizer at Amazon.
We bought our phone sanitizer on Amazon.
Right. The very price all the way from $25 to $150.
They There's a wide variety that vary in price from $29 to $150. As you see in the picture, you can use it for other things besides cell phones, like keys, glasses, wallets, makeup brushes.
Pretty cool.
It's pretty cool. Jackie, we have one more poll.
Yes, this is our final poll. And it is regarding the home protocols and what you think about developing a home protocol. Is developing a home protocol a stupid idea, a good idea, but few do it, a great idea? And the last option is I have one or no consumers who do have a home protocol. So I will go ahead and let everybody answer for their thoughts on developing a home protocol. We will go a few more seconds. And I will stop the polling at this time. And it looks like our answers are 63% think it's a great idea. 21% also think that, but know that few people do it. And 16% have one or no consumers who do it. So it looks like the majority of us believe it's a good idea and have implemented it, but some do not. And I am glad nobody picked the first choice.
Yeah, me too. Thank you, Jackie.
Yeah, me too. Thank you, Jackie.
Okay, so me what? Yes, and I said before, please need to remember that there's entry at consumers' home.
As I said before, the PCAs need to remember that they are entering the consumer's home.
And somebody right to because the reasons that you safety protocol.
And the consumer has the right to request within reason that the worker do safety protocol.
And the other end that is it right to be safe at work.
On the other hand, the worker has a right to feel safe at work.
So it is a protocol which do things like we make that and sanitizer is right to do so.
So if there is not a protocol, but the worker wants to do certain things like maybe wear a mask, the hand sanitizer, he or she has that right.
It is important that all parties involved in safe and comfortable.
It is important that all parties involved feel safe and comfortable.
Talk about vaccines.
Let's talk about vaccines now.
It's about vaccines. this was it. I mean, vaccines were distributed in Ohio.
As of April 13th, 685,
No.
I'm sorry,
This was
6.85 million vaccines have been distributed in Ohio.
2.0 million people are fully vaccinated.
2.77 million people are fully vaccinated.
And that's only 23.7% of Ohio.
And that's only 23.7% of Ohioans.
Vaccines are now open to all Ohioans.
Vaccines are now open to all Ohioans.
But Ohio didn't know vaccines, and what was a nightmare.
For a while, getting vaccine scheduled was a nightmare.
Ohio developed a website and the process.
Ohio developed a website to streamline this process.
The shot that coronavirus the
The website is gettheshot.coronavirus.ohio.gov. So let's talk about some myths and facts about COVID-19 vaccine.
One myth is that the vaccine are safe.
One myth is that COVID-19 vaccines are not safe.
The vaccine has been undergone rigorous testing and have been proven to be safe for resistance and over.
The fact is, the vaccines have undergone rigorous testing, can't say that word, and have been proven to be safe for people 16 years and older. Another myth is COVID-19 vaccines were rushed and developed too quickly.
That is the development clinical trials were zero and the FDA issued emergency approval.
The fact is, the development and clinical trials were thorough and the FDA issued emergency approval.
And that means that the vaccine will be mandatory for everyone.
Another myth is the COVID-19 vaccine will be mandatory for Ohioans.
Ohio will not mandate vaccines,
Ohio will not mandate vaccines,
but it will be available for all those who want it.
but it will be available for all those who want it.
Another way is one vaccine, one vaccine, you do not need to make or
Another myth is once you are vaccinated that you don't need to wear a mask or social distance. Let's look in this one in depth.
You can't stay with a mask and some activity.
You should still wear masks and practice social distancing after being vaccinated.
Vaccinated that seems to attend citizens administration and that the COVID-19.
Vaccines protect against serious illness, hospitalizations, and death from COVID-19.
It's known about red individuals and the virus in others.
However, not enough is known about whether individuals can still carry the virus and spread it to others.
That means unlimited PCAs the
So this means that consumers and PCAs should still wear masks and practice universal precautions.
not everyone is going to we cannot force them.
Not everyone is going to get vaccinated, and we cannot force them to.
However, there are certain circumstances where you can stop wearing masks.
However, there are certain circumstances that you can stop wearing a mask.
Let's explore them now.
Let's explore them now.
If you are vaccinated, you can visit inside a home or private settings with other fully vaccinated people.
If you are fully vaccinated, you can visit inside a home or private setting without a mask with other fully vaccinated people.
You should not eat indoors without a mask with people at high risk for illness from COVID-19.
You should not visit indoors without a mask with people at high risk for serious illness from COVID-19.
You can be in the home private setting with one household of unvaccinated people who are not at high risk.
You can visit inside a home or private setting without a mask with one household of unvaccinated people who are not at high risk.
You cannot attend me without living.
You cannot or should not attend medium or large gatherings.
You can travel domestically without being tested quarantining.
You can travel domestically without being tested or quarantining.
You can travel internationally depending on the destination.
You can travel internationally depending on the destination.
So, in conclusion, we want to be safe in homes and workplaces.
So in conclusion, we want to be safe in our homes and our workplaces.
There has been a lot of fear about interacting with others and working relationship with people and is a close and important one.
There has been a lot of fear about interacting with others and the working relationship between PCA and consumer in a close and important one. Is a close and important one, sorry.
I hope it provides workers and consumers with the tools to have a safe environment in which to receive services.
I hope I have provided workers and consumers with the tools to have a safe environment in which to receive services.
Yeah, in a question that maybe in the chat box.
No, I will
There-
take any questions.
There are a few
in the
questions.
Chat box, Jackie.
Oh, sorry.
Okay.
The first question, who should provide the PPE, the consumer or the PCA?
That's a very good question.
That's a very good question.
The thing,
That depends, I think.
if you're talking about that,
If you're talking about masks,
everyone has their mask
everyone should have their own
if
mask
they're going out in public.
if they're going out in
So
public.
I think the PCAs have their own.
So I think the PCA should have their own.
We might have a couple of
We have a couple of extras just in case.
but if it required,
But if it's
and
required,
the PCA doesn't know it is,
and then the PCA doesn't know it is,
then you can have some available.
then you should have some available.
But I mean, that some people may disagree with me.
Some people may disagree with me.
What do you
What do you think, Jackie?
I think you were right on. I think as far as masks, everybody should have them. That is most definite.
Yeah, I mean, if you're requiring the love or PCAs or something, then the overall and beyond the general mask, and you need to provide it.
If they're requiring gloves or face shields, then you need to provide it.
Because it's not a normal thing
Because that's not a normal thing
everywhere else.
that everyone would have.
Agreed.
Yeah.
Few more questions here. We'll keep going. Somebody made a comment and we want to know your thoughts. We know that sneezing and coughing in our elbow is much better. However, what if there's a possibility, perhaps if a person has to be put in a sling, their face may come in contact with that elbow area?
Yeah, that's funny you should bring it up. I thought it too.
That's funny you should bring that up because I thought of that too.
I would prefer someone to
I would prefer someone to use a tissue
or something that can be disposed of.
or something that could be disposed of.
But legitimate point
But you have a legitimate point.
that the elbow is more like
you're not doing direct care,
and I mean,
hands-on care, I mean.
but it's like,
But that's a very good question.
Yep, that's a very valid concern. Next question we have is, do you know if the county boards of DD have any extra supplies of PPE?
I do not know if the funding board does,
I do not know if the county board does.
but it got our office.
But you can call our office.
It would really help you find some
And we can surely help you find some
if you need.
if you need that. That's what we're here for.
Yeah, certainly call us here at SIL and we'll see what we can get for you and point you in the right direction to find some more.
Yeah,
And I would certainly suggest calling the boards of DD directly and seeing what they might have available as well for you.
yeah,
Next question, can you talk more about travel and if you need to provide proof of negative test or vaccination? And do the airlines set their own requirements? And do the states maybe have their own requirements as well?
but in every state and their own restrictions.
Every state has their own restrictions.
And I believe every airline has their own rules too.
I believe every airline has their own rules
So
too.
it's really important that you include airlines with that.
It's important that you either look on the airline website
Or live on the phone
or call them on the phone
before you go to the airport.
before you go to the airport.
And
I'm not sure if they can require a vaccine. I'm pretty sure they cannot. I think they can request a negative result within like 2 weeks of flying.
But again,
But again, every airline is different. So check the website.
Yeah, and I think, Lisa, those travel restrictions are probably changing all the time as, you know, this is new for everybody. So definitely plan ahead and check early before your travel, for a good several weeks, to make sure you'll meet their restrictions, either the state or the airline.
But it may change in the week a couple times.
It may change in a couple weeks, so you may want to check a couple of times.
Right, exactly.
So
We are about out of time, and right now I don't see any more questions in the chat box. Certainly Lisa's information is on the screen. So if you do have some more questions, feel free to reach out to her. I'm sure she'll be happy to answer any more questions, or give you any more advice. I want to thank everybody for joining us today. And we hope to see you at another one of our webinars. And remember that this recording will be available probably next week on our website or on our YouTube channel.
And also, tomorrow you will be receiving an email from me
Also, sometime tomorrow, you will be receiving an email from me
with a link to the survey.
with a link to a survey.
Yeah, please complete that.
Please complete
So
that
we know if I would do.
so we know how we're doing.
Stay safe and healthy, everyone.
Stay safe and healthy, everyone.
Thank you.
Thank you.
Thank you, everyone.
You're welcome.
Bye.
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 That is correct.